Okay, good morning, everybody. It is 8:25, 2022. Our topic today is covers our policy on patient transportation following anesthesia, and we have our PECU resident, Katerina. I'll let her introduce herself, but thanks everybody who's on Zoom and those of you that are here. I don't know, there's a big crowd, so we'll make sure you speak up. Thank you so much.
Thank you.
All right. So yeah, I'm Catalina. I am the PACU resident, and this is my presentation over the patient transportation following procedures with sedation, analgesia, and/or anesthesia. Basically, this presentation will just go over the policy. Dr. Davis just really wanted me to highlight it, go over some of the nuances and go over some examples, and kind of wanted to make this more of a discussion thing, because obviously I haven't encountered this nearly as much as you guys probably have. So here's a screenshot of the policy that you can find on our policy stat. So basically, patients who undergo procedures with sedation, analgesia, and/or anesthesia at Michigan Medicine, we advise them to not operate machinery or drive for up to 24 hours after the procedure. This policy defines transportation and the need for a responsible accompanying adult companion. So this is these are two things that we'll define in later slides. So does this policy apply to patients receiving just local anesthesia? Yes or no?
No.
Correct. Yeah. So this policy will apply to all patients undergoing procedures with sedation, analgesia, and/or anesthesia, but it doesn't apply to patients who just receive local anesthesia during a procedure. So on that same token, does the policy apply to patients who have undergone MAC case? And yeah, the answer is yes. So it applies to patients who have undergone a procedure under monitored anesthesia care, bless you, or MAC sedation. So to define a responsible adult companion, as highlighted for the policy, so it's a patient or a person, over the age of 18 who is either one, chosen by the patient as a person who is able to take the patient home, understand the discharge instructions, and just be capable of obtaining medical assistance if the patient needs it. Or two is the patient's legal guardian, and this would apply to pediatric patients. Insurance vetted transportation. So this is essentially transportation for a patient who has no other means of transportation for a medical or surgical procedure. This type of transportation is arranged prior to or at the time of procedure, and it is paid for through the patient's medical insurance company. I did have a lot of questions about this, and I talked to Dr. Davis and Dr. Dubovoy about what this exactly means. And so basically it just depends on the patient's insurance, and technically the insurance could cover Uber and taxi transportation. In terms of the safety of what these types of transportations provide, that's not something that our policy really dives into. It's just essentially what their insurance can cover. So the Centers for Medicare and Medicaid Services, the requirements for discharge, I just wanted to kind of highlight what is stated on their website, because it's kind of what our policy is derived from. So they put on their page, just so to provide each patient with written discharge instructions, overnight supplies, when appropriate, make a follow-up appointment with the physician, and ensure that patients are informed either in advance of their surgical procedure or prior to leaving the ambulatory surgical center of their prescriptions, post-op instructions, and contact information for follow-up care. Ensure that each patient has a discharge order signed by the physician who performed the surgery or procedure in accordance with applicable state health and safety laws. And to ensure that all patients are discharged in the company of a responsible adult, except those patients exempted by the attending physician. And so, yeah, basically kind of what I just touched on. So the CMS, they require that all post-op patients are discharged home with from PACU with a responsible adult companion, or they need to have a physician saying that they can go without one. It is expected that the surgical service will place that kind of order stating that the patient can be discharged without an RIC, but with insurance-vetted transportation. So both the Michigan medicine policy and the CMS, they both state that if these two requirements are met, then the patient can go home. But obviously, if the PACU team feels otherwise, we aren't obligated to send them home either. If they meet that type of criteria, it's also up to us to, you know, see if like we don't think that patient will be safe to go. UMHS policy procedures. So this is exactly what's typed out in our policy stat. So kind of just to go over what is said. So patients will be advised that they can't drive or operate machinery after 24 hours. All patients undergoing procedures with sedation, analgesia, and/or anesthesia must be accompanied by a responsible adult companion, or upon physician order, they can leave the facility with insurance-vetted transportation. The responsible adult companion will be expected to accompany the patient home and remain with the patient while they continue to recover from anesthesia. A patient who arrives without a responsible adult companion or without a plan to use insurance-vetted transportation service, they can have the procedure canceled if no responsible adult companion can be identified and is available to accompany the patient home. Social work or patient relations and clinical risk, they can be contacted to assist in addressing these type of issues regarding both responsible adult companions and safe transportation. And Dr. Davis really wanted me to highlight like the wording on some of these things. So like example for this statement, so expected, like the responsible adult companion to be expected to accompany the patient. So it's not a requirement for someone to stay home with the patient, but it is an expectation for that to happen. And there also isn't like a definitive timeline for how long this person needs to stay with the patient while they recover. That's something that's also not clearly stated in the policy and is pretty much left up to interpretation. So what if plans fall through? Let's say if an insurance-vetted transportation service is arranged prior to at the time of procedure, but it's not able to be completed for whatever reason, we could get social work involved. And social work can attempt to assist the patient in finding similar transportation, provided the patient has capacity, is agreeable to the transport, and there is a physician order for discharge. So a couple examples to go through. So patient X is post-op, minimally invasive surgery, and the plans to be discharged home from PACU. The patient does not have a responsible adult companion, but arranged for insurance-vetted transportation by the surgical service, and the surgery team placed order saying patient's okay to go without a responsible adult companion. In the PACU, patient was expressing worry how they will be at home by themselves, recovering from surgery, and became anxious about having to take care of themselves. PACU nurse notifies the PACU team of this concern. Are we required to send the patient home in this scenario? Yeah, exactly. Even though they have the order saying that they can go, and it's essentially not a requirement for them to go. All we can do is just advise and recommend and talk to the surgical team about this, and just try to do what's safest for the patient. Patient Y presented to PACU as a post-op, is recovering from general anesthesia. Once more awake, patient is demanding they leave to go home because no one is watching over the patient's children. It's learned that the patient has been living at a homeless shelter and denies having a responsible adult companion to watch over the patient as they recover from surgery. The patient would like to leave against medical advice. What could be done in this scenario?
Social services.
Mm-hmm. Yeah, definitely. Social services to, arrange appropriate care for the patient's children, and also make arrangements for insurance vetted transportation. You can also consider patient could, stay, get admitted, all these options, and obviously talk to the patient, show empathy, try and figure out like a good plan that you both can agree on, and also notify the surgical team and or anesthesia team about the situation. Patient Z presented to the ED for kidney stone, and urology booked his case for the next day for uteroscopy and stone removal. Lives in Ann Arbor, has 3 roommates. One of them agreed the night before surgery to pick up the patient after the procedure. And the pre-op patient expresses to the surgical resident that unfortunately roommate got tied up at work and is unable to pick him up after the procedure. What should be done in this scenario? Yeah, so the surgery resident that talked to the patient pre-op could call social work, have them arrange insurance vetted transportation. There is an option to cancel the case as well. However, this procedure wouldn't exactly fall under the elective category, just because the patient did present to the ED. They're probably experiencing a lot of pain, discomfort from the stone. So it would be detrimental for the patient to have to wait for this to get removed as well. But it's obviously a conversation that you can have with the patient, and very dependent on, our comfort level, the patient's comfort level as well.
Is that the scenario that you had a couple weeks ago? Or
last week?
I mean?
Yeah.
Ended up getting admitted?
Yeah, he ended up, I think it
I
was,
was gonna say, so what happened with that one?
he ended up getting admitted to, I think, medical short stay or observation. But I don't know what happened after the next day. Maybe he was able to get picked up. But he underwent the procedure. It was uncomplicated, and it was just trying to figure out where he could go after that. Yeah.
Such a gray area sometimes.
Yeah.
Like,
But the for insurance, transportation, like anybody who uses the district, we're after they, at a cost. What I'm asking, I guess, is, are these insurance companies aware that these people are having major procedures done at surgery done and are being jumped off? Being sitting in a ride share and being sent hours away without a responsible doctor? Let's be real, if I'm an Uber driver and you give me some surgery, I'm not doing anything for it. I'm just being honest with you.
yeah, I'm not walking in the door either.
Yeah.
Have we talked about this in risk management? It seems like a very huge gray area.
I know. Yeah.
But you could always include risk management.
There's some questions here in the chat too.
Like, do they have, sometimes you can do it if there's a responsible adult at the home.
But
Well, how do you know?
exactly.
It's not like the Uber's gonna call you back like, you out.
So, yeah.
She said that in March, where they were supposed to go home, and then, of course, she was expressing that she was concerned, but actually, come to find out, social work was involved. She wasn't going home, she was going to a hotel that had a nurse that was able to come during the day, but wasn't gonna be there overnight. And it was at Mott, of course, it was 8 o'clock as she's being discharged, everyone's leaving, so she ended up just staying.
There's never any issue.
I think that, these scenarios that come up obviously are going to be they're challenging, and it's, those one-offs that it's like, okay, they say they have a responsible adult to take them home, but nobody's going to be at home. I could say that I have a responsible adult all day long, but really, who knows? It could be my 14-year-old son at home. Is he responsible enough? Okay, but it's not going to be our job to investigate that much detail. Because then we're going to be admitting everyone. But obviously the point of today's presentation was mainly more or less like the ride, who's able to drive them, operate heavy, we always say heavy equipment and stuff like that. The questions in the chat, what if the patient has a ride home but doesn't have anyone at home? Okay, so that's what, there's been discussion out here, Jason, about this. That's that gray area. I don't know. I mean,
Yeah.
we're not really getting into that much detail, but Melissa also says, I've never seen the surgical team place this order that a patient is clear to leave with an insurance vetted transport. It happens all the time. Additionally, I have seen them place the order for DC without RAC either. Is this something that's actually happening? Or are we missing that?
I've never seen
Yeah.
that order. Should we be talking about this more in pre-op, like making sure before the patient goes back, like,
Yeah.
hey, you have somebody that's gonna drive you
I'm
home.
also unmuted because I have another question. It's Melissa, sorry. So let me know when I'm okay to ask
Yeah,
it.
so my cousin's driving me home, and I'm like, are you taking Cindy overnight? Well, no.
Yeah, I guess I'd care not.
So I know there's gonna be a lot more discussion. I feel like after, this is kind of opening a lot of can of worms. What else is that? Do emotional support animals? No. Unless it's a horse or no. That is very complicated, Crystal. Leave it to you to throw that on there. Yeah, no, I think that we're moving into like their home life, and that's not our role as nurses. If there's any question, I think we need to get social services involved. If there's like a true red flag,
Yeah.
if it's going to be super complicated, and that is basically what you speak to as far as our guidance.
Yeah, it's like there's like no answers for these very important questions. Like a lot of our patients like come from the UP and they're like hours away. And I've thought about that too. Like, what if something happens on the road,
Right.
And it's just like, yeah, like these people don't have training to like drive back to the hospital. It's like tough. And like this policy doesn't say what happens in those scenarios. It just like what happens here, what we do, what are our procedures here. And it's all very vague what happens after that,
So I think there's a lot more work that this policy was updated in 2021, I believe. And I know that's an anesthesia policy that trickles down into PACU. So
yeah.
Dr. Davis wanted us to, review this and talk about it, but I think there's a lot more work that needs to be done or just so we have a better understanding even. But my take or my understanding, and I'm not the know all end all, and doctor, you can, intervene more, like if it's the surgical concern, the surgical team should be writing that discharge order.
Yeah.
Like we might have to continue to ask them that they're okay to send that patient home. Anything more, then we need to get social services involved because their home life, again, like we're not gonna like nitpick on who is at home or whatever, but for today's purpose was more or less like the ride, who's driving them. And we've had scenarios where people will just say, yeah, I have a service. This happened like a few months ago. I don't know if any of you were here. It literally was like a BMW that this guy got. What is you, Steve? Yeah.
2.5 hours away. So that's why I brought it up because of from the scenario.
Yeah.
I think we're using this term, insurance vetted, differently than we should be.
Yeah. 10 years ago, insurance vetted was like a transportation van. Now we have Uber and Lyft and
Yeah, I think it'd be full. And think of if I were an Uber driver, and I told them, hey, this dude just had surgery, by the way. Good luck. I think half the time the Uber driver is gonna be like, cancel and move on.
Yeah.
Maybe not try to get their money. It is what it is. I think it'd probably be a 50-50 thing.
yeah,
But that dude drove away 2.5 hours
right.
in an Uber.
Yeah. And he left, right? He did go. Yeah.
Anesthesia, you made them put that discharge order in, they will say for the home.
Yeah. So that was, that was the answer. The surgical team had to sign off on that.
I have no idea.
Is there another question?
That's why I said maybe I should update things.
From a pre-op perspective, the surgical clinics are not managing this prior to the day before surgery most times.
They don't know this kind of balance.
Oh, so if the Uber taxi is covered by insurance, is that okay to send a patient home? So when is an Uber or taxi covered by insurance? I don't know. Like, how do you, that I don't know. Yeah, how you get an Uber.
Well, that's what she had said in the presentation that's what was said in the presentation I saw on that slide, that if insurance vetted transport is an Uber or a taxi sometimes. So if that's what we're saying insurance is covering, do we then put them in a taxi by themselves? Or am I not understanding correctly?
Yeah, no, that's pretty much what I got from that too. Like, if that's what
Okay.
the insurance company will cover for those rideshare apps or taxi, then
So they will do it. I
then
mean, I
that's
guess-
technically falling under insurance vetted transport. So they can
Okay.
after their
This
surgery.
is a hot topic for us in the call room because a lot of times we are the ones catching this the day before surgery, and it turns into an absolute dumpster fire trying to get a hold of the surgical team, and they have no idea that this is going on with the patient. So I think this was awesome to explain some of this stuff, but Tricia, just to touch on what you were saying, I think this is way above anesthesia and PACU sometimes.
Yeah,
The surgeons need so much education about this. Like, there has to be a change in the clinics because this is where it starts, and most times it's not resolved before this patient comes in. You know, they're 80 years old and they live 6 hours away and they have no one around them, and no one knows that until less than 24 hours prior to surgery. That's unacceptable.
Yeah, I agree with you. I think we all know that, like, in our world, and it's a matter of, getting this back to the surgical teams and making them aware before that patient even steps foot in our department. Sometimes though, I think that I don't know, they are so worried about getting the patient here, forget somebody else's problem then.
Absolutely. This one is a hot topic for me, so I get a little passionate. But thank you for all the clarity and going through the policy. We're learning it's not very clear and leaves a lot of room for interpretation, like you said.
Yeah, that's what I got from that. Like, yeah.
The surgical team, yeah.
Is it just a regular Uber? Because I know Lyft has like a health, they have like, Lyft has a special service, but.
Yeah, they came out, I don't know if it's still available or not, but it's just a regular Uber, a regular Lyft that shows up first, but they did call on that. They sent on his phone, they sent him a link. The insurance company sent him a link to Uber. Gary had Uber downloaded, he had 3 people pick up his Uber in a matter of like 3 seconds.
The other question, just for you guys on Zoom, the other question was, is it just a regular Uber, like Uber or Lyft? Like, so there's no special, like, certification, or it's just, yeah. Mike chimed in and says other places require RAC to check in with an outpatient upon arrival. I know we obviously don't. I think this is a lot, like, good feedback from all of you, and obviously we have a lot of some information to pass on to the surgical teams, and I think at the end of the day, like, we just got to utilize our resources and know that when we need to have that surgical team sign off that it's okay to send them home with a insurance vetted option. I know, yeah, we're already struggling with discharge orders as it is, so. Thank you for your time and digging through this policy for us, and I know it's not like a super fun topic, but it's clear as mud, exactly.
It's
Honestly.
yeah.
Like, patients lie. No, I mean, it doesn't matter if they lie.
Yeah,
I mean,
yeah.
if they're desperate to have something done and if they're considered outpatient.
They're gonna get here however they
Right.
can, and they'll try to
they're
go
like,
home.
yeah,
however
and they
they
have
can.
someone pick them up. I mean, like.
Yeah.
I think we don't think it's such a big deal, so it's too late. And it's like you wake up, it's like, okay, now you gotta go home. It's like,
Like you had the surgery, everything went well, now how are you getting home?
Right.
Yeah.
I think they are absolutely time to go home. If they are independent, we can watch. Are they physically independent? Are they okay to do the things for themselves? If the surgery is agreed, we shouldn't make like such a big deal. Oh my God, they don't have any long way down. I don't know how many of you had procedures, but I had like surgeries in the past, and when I went home, I was perfectly fine. Like they discharged me when I was
I
ready.
think that like, then you're getting into like the legality of
I
things
know.
of
I
anesthesia.
have my family in the house, but I never experienced anything weird. I want to know like how many times did we really have issues discharging patients home and they went home and something happened to them.
Yeah.
Like they couldn't care for themselves. Like somebody died. What happened?
No, Sarah,
Such a big
Sarah
deal.
Winston's patient died, and there was a big hubbub about it. They were going home, they stopped in a rest stop to go to the bathroom, whatever, and they went out, and then they came back in, and he had a heart attack and he died. And it was a big thing, you know.
I mean, and that could have been their spouse and was like
Right.
a fully,
When
you know,
have a heart
competent
attack,
adult.
you would die anyway. It happened. It was in the hospital.
I'm gonna go ahead and stop recording. Goodness. All right, thanks everybody for zooming in.